Pacifiers are a popular tool to help calm babies when they are teething or when they are just having a hard time. But many parents don't realize that using a pacifier can have serious consequences. The dangers of using a pacifier range from malocclusion teeth misalignment to an increased risk of infection and suffocation. In addition, there are reports that prolonged use of a pacifier can lead to speech development problems in young children. In addition to these risks, pacifier use has been associated with an increased risk of ear infections, difficulty breastfeeding, and even obesity. It is important to understand these dangers before deciding if a pacifier is right for your baby. Here we will discuss the risks associated with using a pacifier and how to avoid them if you choose to use one. The best way to prevent the negative effects of pacifier use is early weaning. It is recommended that babies be weaned off pacifiers in the second half of life to reduce the risks mentioned earlier. First, at 6 months of age, babies usually have the ability to fall asleep without the use of a pacifier, and so they do not require one to fall asleep. In addition, at this age, children can become very dependent on the pacifier, and this can negatively affect the child's sleep and lead to more frequent nighttime awakenings, and sleep may also become shorter. Secondly, when a baby sucks on a pacifier while awake, he cannot take toys in his mouth, as they actually do at 6 months of age. Thirdly, the pacifier prevents the baby from making sounds and preventing them from starting to babble, which are early stages in the development of their communication skills. And this can negatively affect the development of their fine motor skills, as well as their language development. Fourth, around this age, babies begin teething and may accidentally pierce or break the nipple when they chew on it in an attempt to relieve the pain of teething. Studies show that adverse dental effects can be seen in children who continue to use a pacifier past 2 years of age, with the most significant malocclusion in children who continue to use a pacifier at age 4. Age, intensity, and frequency of sucking can greatly influence whether future dental problems occur. Therefore, in order to avoid future health problems for the baby, limit the use of the pacifier. For example, use a soothing pacifier both during sleep and before bed. Be healthy,